Hi, my name is Erin Jarvis, and this is my submission for the assignment using anatomical terminology for Anatomy 1120. I am going to go over a couple of foam rolling exercises using anatomical terminology. To begin with, I am going to focus on the posterior crural region of the lower limb and place that foam roller at the proximal end of the Achilles tendon and slowly lie my dorsal region down onto the ground. Moving my upper limbs through the frontal plane, I'm going to clasp my phalanges together at the base of the cephalic region, just above the cervical region, for some support. Here, I am going to take my contralateral lower limb and cross that tarsal over the anterior surface of the inferior lower limb, just like so, and then begin the rolling. So to start, keeping my pedal relaxed, I'm going to laterally and medially rotate the inferior lower limb across that transverse plane like this. As soon as you feel kind of a sticky spot or a knot, you can stop that rotation and circumduct that pedal. You can achieve this by plantar flexion and dorsiflexion of that pedal in a circular motion, about 3 times each direction through that transverse plane, or until you feel that knot kind of melt away. And when you're ready, you can move on to the other lower limb. Next, I'm going to show you how to roll out your tricep, which is also found on the posterior region of your body, superior to the olecranon and the inferior to the acromial. Lying on that inferior lower limb, you're going to rest on the foam roller, flex the inferior lower limb at the knee and the hip joint through that sagittal plane, and then lower your body onto the foam roller at the proximal end of your brachial, just below the axillary here. From here, I am going to gently roll the distal region of the brachial, just above the antecubital and cubital, then back to the axillary, just like so. And when you're ready, do the other tricep on the other limb, and then you have 2 new foam rolling exercises for your workout routine.